Hi everyone, I'm Kate Ginn, the program manager for Help Me Grow Pierce County. I'm here to tell you a little bit about this legislative session and what it means for our child welfare prevention pilot and how we're now implementing the system of support for families with children from pregnancy to age 5 in Pierce County. So in our community planning year that ended in the summer of 2019, we created together as a community this vision that we would have a vibrant community where all families have the resources and confidence to support, protect, nurture, and dream for their children. So although we started with this goal of preventing young children from entering foster care, we really are working towards a system of support that applies to any and every family that we all have needs when we bring a child into our family, when there's a new baby, and we don't want anyone to feel like they are parenting alone. We want to be a community where all families can find support in whatever form that looks like for them, that they can get expert research navigation to connect to community support, and that they can feel supported and just feel that they're not alone. And this is a really generic vision, but it became really important, right, when none of us could have foreseen the COVID-19 pandemic in 2020 and how that would affect families with young children, how it would increase social isolation during the postpartum period for so many, increase the need for basic needs support because of the economic crisis as a result of that. So it really has allowed us to be a flexible system to adapt to the emerging needs of families as those needs change. What implementation looks like today, Help Me Grow Washington, the statewide Help Me Grow, has added these two components at the end here, equity and advocacy, as a key part of implementing the Help Me Grow model. The national Help Me Grow model includes these first four components. We continue to have 4 action teams that meet on average monthly to advise on how these 4 components are being implemented for Pierce County families. And we now have staffing around each component. We have a healthcare liaison who's employed at the Tacoma Pierce County Health Department who helps make sure that pediatricians and prenatal care providers are aware of the resources in their community and can easily refer their patients to be connected into the system of support. We have family and community outreach staffing at the Multicultural Child and Family Hope Center as they interact with parents and connect them to the services they need. They're really making sure that parents feel supported and are aware of the family resource navigation available at 211. We have 2 family resource navigators at 211, as well as some staffing to ensure that we have a comprehensive resource directory. And we're all as a community working hard to make sure that 211 has the most up-to-date information to share with families as they are calling. And then we have a data team at the health department as well to engage in program analysis, to evaluate the monthly data from 211. This became really key during COVID. We weren't sure, other than anecdotally, how the needs of families were changing, but looking at caller data really provides this real-time data about what people in our community need, what they're calling for, what resources they're looking for, what age of children they have, the demographics. We together are looking at that data on a monthly basis to identify resource gaps. And our family and community outreach team in particular has been engaged in brainstorming and connections to try to fill those gaps. And then we have a new staff person I forgot to mention at Hope Sparks starting in January, who will be focused in particular on the 98444 Parkland area because that is a very highly used diaper bank. We know it continues to be in the caller data, one of the top zip codes pretty often of where families are calling from. And we are engaged in trying to make sure that families in that area have access to the support system. And we have equity infused into all components that, in particular, as we look at the data, it's disaggregated by race and ethnicity, and we're really addressing opportunities to redistribute resources to families of color and where they are most needed and have been historically left out of services. And lastly, we work with Project Child Success on the advocacy piece, and that's why you all are here, to find out how you can engage with legislators and asking them to support the continued funding for Help Me Grow Pierce County, so we can continue to have this infrastructure for families over these next 2 years as we finish our 5-year pilot and really share our learnings with the state, as so many communities across the state are working now on building up local Help Me Grow systems as well. We have the same pilot goals: continue to reduce the need for child welfare services by focusing on prevention and family support as upstream as possible, to improve birth and child health outcomes, really doing outreach focused on pregnancy to make sure that we're reaching families as early as possible with the support they need. And then across the board as a community, to share resources and information about child development, that we can be a community where we all are helping one another and increasing knowledge about child development and what young kiddos need. Our 3 focus zip codes are South Tacoma, Lakewood, and Parkland, as I mentioned. While the Help Me Grow system is available to any family in Pierce County, we have been focusing on these 3 zip codes in particular in terms of outreach, making sure we're looking at the needs of families who live in these zip codes, and working on expanding access to resources in these zip codes. Our caller data in 2020 last year, as you can see, the majority of callers to 211 are families of color, and that's not a surprise because of the need for basic needs support, but it is underutilized by families who are Spanish speaking. So we have been working on making sure that resources are translated into Spanish as well as other languages, and focusing on how to build up increased services in the Parkland area where there are many families who are Spanish speaking and are utilizing the Diaper Bank site there if they're not calling 211. So we really see the family support centers and our partnership with the health department as family resource navigation in community, that these are touch points where families who may not feel comfortable picking up a phone maybe are building a relationship with an individual at a family support center and are able to get referred to the appropriate resources through that relationship. And then the needs of callers, we don't look at all the caller data. We look at the data of callers who have children aged 0 to 5 in the home or who are pregnant. But still, with the subset, housing and basic needs continues to be the top concern. Also, why a lot of families are aware of 211 is because of housing, but they're also looking for information, for community support, for diapers, of course, and other essential baby supplies, any sort of utility assistance or basic needs to help fill the gap right now with so many families in 2020 in particular facing unemployment or less wages due to COVID-19. And then about 2/3 of callers report that they are not stably housed, that they're either experiencing homelessness, at risk of homelessness, or fleeing domestic violence. So we are really concerned with resource follow-up and making sure that these families are getting connected to what is available and are able to stabilize. We now have 10 Diaper Bank locations as of December 2020, and this was a gap we were able to work quickly to fill when it was identified starting in May of 2020, not just because of the pandemic, but something our community already knew there weren't enough places to go to refer families who needed some extra help with having baby supplies on hand. So these are the 10 locations. Most of them are family support centers as well. So we really see that if families, they may be going for diapers, but hopefully they can also get information and get connected to referrals to other resources as it's needed. And then we, now through December, we're able to give away over 100,000 diapers in 2020, also packs of wipes, and then we're now serving over 400 families a month with free diapers and wipes, and hopefully with information as well, and relationships and identifying other community support available to them. So thank you all so much. You're going to hear from Emily, my colleague, but because our slides were not all in order, she's going to talk about Family Connects and the Help Me Grow system, but I did want to end in our ask that we are thrilled that the governor has included a $1.74 million appropriation in his budget for Help Me Grow Pierce County with Family Connects, so including the nurse support for families with newborns and piloting that in the 3 zip codes as we continue to look at other avenues to expand that service to Pierce County families. So this will take us through June 2023 with continuing the infrastructure, the family resource navigation, and the data analysis and the family outreach component to really make sure that families are aware of the support available to them. So we are asking our legislators to support this amount that's in the governor's proposed budget, that we hope it will also be in the final budget at the end of the legislative session. So as you are talking to Pierce County legislators in particular, we just ask that they would support this and see the value in it, not just for Pierce County families in responding to the pandemic, but in particular for providing a model and providing learnings that we are open to sharing with other communities in Washington who are interested in building out local Help Me Grow systems in partnership with the statewide coordinated access point at Help Me Grow Washington. So thank you all so much for your support, for your care, for your tireless dedication to Pierce County families and making sure we are building the community for children that we all would like to see. Thank you.